committees. Okay. I look forward very much to be presenting here today to your two subcommittees. So thank you so much for inviting us here today to talk with you. There's a few items that I was specifically asked to address, but I also just want to start off by giving everybody a general overview of what our agency is and does and who we are. So our agency is the Corrections Department. We house people who are incarcerated with state offenses, and we also supervise people on probation and parole in the field. We have 11 correctional institutions throughout the state. 7 of those institutions are state operated, and 4 of them are operated by private entities and overseen by our agency. We have a total of 5 district offices with probation and parole, an interstate compact office, and in those region offices, we have 46 district offices located throughout the state where we supervise people who are on probation or have released from institutions and are on parole terms. So one of the things that I believe Carolyn mentioned a little bit earlier was just some of the things that we're doing in our agency right now. And one of the things that I'm most excited about are the changes that we're making to our reentry division. Our reentry division it's just an incredible area where there's tons of opportunity for growth and for making changes that will help the state become stronger as we help to work with people who are in our custody to gain skills and learn more about themselves and how they can be contributing members in their communities when they release. Previously, when I first entered into the agency, I found that there was a bureau for reentry and recidivism reduction, but there were very few people who were actually assigned to that area. And those people were really just struggling. They didn't have a lot of resources or support from anywhere really. And that's been my primary focus since I've taken on this position. We are elevating it from a bureau level to a director level, or a division level rather, which means that it will get the attention that it needs with respect to resources and attention and engagement between institutions and field offices, which is not something that was previously in place. That area right now is in the process of working to bridge gaps in service by focusing on pre-release planning before people are released from institutions. And what that looks like is when people are getting ready to leave, we want to spend time with them to make sure that they know what they need, and we want to have individualized plans for each person that's under our supervision. So we have a tool where we're able to create these assessment tools and transition plans that already exists, but in the past it was only being utilized in the probation and parole field, and now we will be starting that assessment tool while a person is incarcerated. And the goal is that when that individual is released, they will already be set up with services upon release. So they'll have access to treatment counselors, therapy, behavioral health needs, and we'll focus also on helping them with finding work and making sure that some of those items that can be barriers to success, that they get help in those areas, like obtaining legitimate identification and things like that. Small things really are very big things when a person is trying to make that transition from an institution into the community and back into their family world. We have also been working to expand our peer mentorship programming, which will allow people to learn how to be peer mentors, potentially be able to become employed as peer mentors post-release. And then for people who are releasing, as we get this in place throughout our region offices, it will give the individuals releasing from institutions a person to work with as a mentor, so to speak, somebody who can really help them walk through the process, who's been through the process themselves and has that personal experience. In the process of creating this reentry division, we're also pulling resources from what's called our adult prisons division and then also our probation and parole division, and merging them so that they will be working together to focus on all of the needs before the individual gets out. So for every person who starts to release, as we implement these changes, they will They will be able to have the opportunity to meet not only their own direct supervising probation and parole officer via video, but they will also be able to have time with regular meetings with reentry and transition specialists so that they can start preparing for their release before it's time for them to get out. So with that, I'm going to move on to some of the items that you all mentioned. And I'll start off with the training and hiring. There was a just general question for me asking us about hiring practices and training. And that is actually another one of the areas that we've made some very significant changes to over time. I'm picking up some feedback there. I think I hear sirens in somebody's background. Okay, there we go. Thank you. So in the training area, we used to have a really strict method for a person to even enter into our training area. They had to meet lots of physical fitness requirements, and they really were expected to come into the academy fully ready to graduate from the academy. And when I looked at that with my team, we said, well, why aren't we teaching people? We should be teaching people about physical fitness. We should be helping them become better physically so that they're able to meet our requirements rather than expecting them to come into us in this particular condition. We were losing a lot of applicants by not focusing on actually training them, but just expecting them to meet certain criteria right out of the gate before they even started with us. So what we do now is that applicants are required to get an assessment and an approval from their own personal private medical provider. And as long as that medical provider says that they're fit and it's safe for them to engage in the academy and the activities that are expected in the academy, we will bring those folks in. Our academy has transitioned its focus to spend lots of time on teaching people things like nutrition, physical fitness, mindfulness, and our training has really started to move towards focusing on communication techniques. So we do large segments in our training academy that focus on things like teaching people motivational interviewing, and a lot of time we spend also on behavioral health first aid so that our staff are better able to de-escalate situations rather than entering into a situation in an institution and having their own behavior contribute to an escalation, whereas their role really should be to bring down any type of tension or frustration that's taking place. And we've focused our efforts very much on making sure that all of our staff are provided with these communication tools and opportunities. So in doing this, we've actually seen a significant increase in the number of people that are graduating from our training academy. We've been able to fill vacancies in facilities that had been larger vacancy percentages over time. And it really has made a very significant difference. We didn't remove the physical fitness requirements. I want to be clear about that. It's very important that all of our staff are capable to respond and that they're safe in the environments that they work in. But rather than having them be so stringent on the front end, we teach people how to be where they need to be in order for them to graduate from the academy. So we still have those physical fitness requirements, but they're at the end as part of the final completion test process to complete the academy. That's been something that's been very important, because when we do have a cadet that's struggling, we will be able to spend extra time with them off hours, taking them to the gym and teaching them things about how to do certain exercises. We develop nutrition plans for people if they need it. And we really take the extra step to make sure that our trainers are helping people pass the physical fitness requirements by teaching them how to exercise and eat right and be generally healthy in order to meet those basic requirements. Another one of the questions that was posed to me was, what is my level of authority over jails and other correctional entities in the state? So, all right, sorry about that. I just needed a little bit of water. technically, I do not have oversight over any of the jails or any other institutions in the state of New Mexico, but our governor is concerned about every New Mexican who lives within the borders of the state of New Mexico. And so as we have worked through the pandemic, the public health crisis that everybody is dealing with and working through right now, I have been in near constant communication with folks from the Department of Health who do work directly with the county jails and the other entities to make sure that they're meeting the needs. We've also met regularly with the Association of Counties, and we've had meetings with the individual jails so that we can share with them best practices and make sure that they are trained and well aware of how to do things like separation and quarantine to make sure that their institutions are safe. We work with them and the Department of Health to make sure that testing is done appropriately in their institutions and that rapid responses are conducted appropriately. So while I don't technically have oversight over any of the county jails, we are regularly communicating with each other, and we offer them all of our policies and procedures that we've put out to our own institutions. And we are always willing to go into an institution and offer any services or assistance that our partners in the counties need. So I will move on to the medical questions. It was really just a general question, and I wasn't entirely sure what the committee was looking for, which is why I asked Mr. Asangani to join me today. So one of the questions that was on the list was copays. I was asked if our inmates incarcerated have copays. They do not. The state of New Mexico has not ever had copays for inmates. Inmates receive care based on what their needs are. And we have never at any point, and nor do we anticipate in the future, implementing copays for people who are incarcerated in our corrections system. In general, we do provide medical services in all of our institutions, and we do that through a medical corrections contractor. Our current contractor right now is Wexford Health Services, and I'm going to turn the floor over and have your questions answered by the health expert. And then when he's through, I will finish up with some of the other items that were on the agenda. And then of course, we'll provide the group an opportunity to ask either one of us questions. Is that good?
That's fine.
Okay.
Thank you very much, Madam Secretary. And again, I'm the Health Services Administrator, so I'm going to spend some time to address two items: current health management at the facilities. As already mentioned, Wexford is our current medical vendor. They are the boots on the ground. They do all the hiring of the clinical staff, but we have a role in terms of oversight, in terms of monitoring that they're meeting the expectations of the medical vendor contract. We do start from the very front end where we intervene in terms of who they hire. We don't just rely on them to tell us that this is a qualified physician. We have our own independent process where they send the resume and then we validate the credentials independently, as well as security aspects to make sure they do have the qualifications in order to provide care. Beyond hiring, we do have our policies, which Wexford is supposed and is expected to follow those policies. However, they too do develop more frontline or guidelines that they provide to the nurses, the physicians to use, and those two are vetted by us. We do have scheduled either planned as well as unplanned visits to make sure that the care that's been provided meets various standards. So we have a schedule where we plan out audits in the facilities. Currently, as of today, we are at 45% audits in terms of detailed healthcare services and somewhere around 20% with our ACA audits. These are independent audits that we carry out at the level of the Health Services Bureau, just to make sure that the inmate patients are receiving care commensurate to the care that anyone out there in the community is receiving. While we do have staff, Wexford staff provide this care, we are well aware of the fact that there are instances where the inmate patient needs might not be able to be provided. And so there are policies, procedures in place that allow that a patient whose needs cannot be met at the level of the facility, at the level of the institution, is transferred to a more suitable hospital, either an emergency or in a community clinic or in a specialist in the community. So that's how we try to meet all the needs of our inmate patients. We do, in order to monitor them and make sure that we are more proactive than reactive, on a weekly basis, we do meet with our medical vendor, and we talk in a very, very detailed level where we address everyone who has left any institution to the hospital. We try to find out, why did this patient meet the criteria to go to the hospital, or why did someone who ought to go did not go? And we analyze in terms of the emergency reports in order to make sure that the care that was provided meets our standards as per our policies. This happens on a weekly basis, and then we follow up on any items from previous week. It also gives us an opportunity to plan in strategic ways and create new programs. As you might be aware, the governor is very interested in making sure that hepatitis C is eliminated in the state of New Mexico. That is an initiative that we've fully taken on board, and we've invested in terms of equipment, we've invested in terms of extra staff. At this point, I'm glad to share with you that if there's any inmate patient in our system that requires care to hepatitis C, that's something that we screen the patient and make sure we do offer them the care that they need. We've also had a special appropriation fund to cover this. Also, prior to my arrival, a lot of important legislative work had been done here that provides us a very unique opportunity to have access to medications at a very, very reduced rate, which is the 340B program. So that's a program where we are part of, and we can now treat more patients with the same amount of money. Not only more patients, but they have access to an array of medications. There is actually, I would say, no health condition that we explicitly exclude any of the individuals, the incarcerated individuals here. So no matter what your condition is, we will assess you and make sure we develop a plan that can meet those needs, irrespective of how challenging they are. We are very, very conscious of the fact that we have a diverse inmate population. In terms of, just to share some numbers, in terms of the top three main inmate population groups that we have Hispanic whites that make up about 57% of our population. Of course, this is a dynamic number. It might go up and down depending on when you carry your statistics, but our most recent census leads us to that number. And white incarcerated individuals are about 26%, followed by Black African Americans, about 7%. The lower percentages are the Native Hispanics, 1%, Black Hispanics, 2%, and Native Americans, 6%. Again, these are dynamic numbers, but a snapshot as of June 30th reveals those numbers to you. We provide responsive, equitable care. What that means is at times, our care might not seem as if it's the same, because of course, if we tailor the same care package to every inmate a patient, it would not be fair. We know that based on studies out there, based on guidelines out there, some groups of individuals are predisposed to some medical conditions than others. So those are things that we actively try to make sure in the course of our weekly discussions with our medical vendors that they should take these aspects into consideration and not just offer a one-size-fits-all while we stick to our policy we try to be very responsive to individual needs. I think in a nutshell, that gives an idea in terms of how we operate here, medical services through a medical vendor. And then, as I said, we cover all aspects of health, not only physical, mental, we have social workers, psychiatrists, and what have you. I'll be open to any questions when the time comes. Thanks for listening.
Thank you. Okay. All right. I want to add one thing to that. You know, we've been working with Project Echo for a number of years, and I'm sure many people on this group here are familiar with Project Echo, but it's been a really great tool because it allows our inmates to learn about various public health needs and issues, and then to teach each other. So we have the ECHO project set up in 10 of our 11 institutions, and the way that the inmates are able to engage is that they're provided with a subject from the experts that they work with over video linkage, and they learn all about it, and then they are scheduled to put on a presentation for other inmates in other institutions, and every group has the opportunity to do this so that not only are they learning about a public health issue, but then they're having the opportunity to be able to teach and learn and share their experiences and the information that they've learned with each other. We have found it to be a very effective tool to make sure that our populations are aware of public health issues, needs, concerns. And I was just looking at the time. I think that we hit our time, and I want to make sure that I give the group an opportunity to ask any questions. So with that, we'll stand for questions.
Dr. Bencomo?
Thank you, Shani. My subcommittee on public safety knows I'm not shy about asking questions, but I'll limit myself to two in order to respect everyone's time here. My first question is in regard to the 4 privately owned and operated institutions that are overseen by the state. I know that a recent development, or at least it's my understanding, that the Clayton facility, which was privately owned, has recently been taken over by the state. I wanted to just make sure that that was correct information, but also I wanted to know if there are any plans in place to look at the state acquiring any of those remaining 4 institutions. So that's my first question, and I'll let you answer that, and then I'll ask my second.
Okay, thank you, Mr. Bencomo. The facility in Clayton, yes, it was previously operated by the GEO Group, and it was taken over by the state of New Mexico in November of last year. And that transition has gone very well in all respects. We've been able to bring up the rates of vacancy and increase the amount of program opportunities available to the inmates. As far as any plans to take over additional institutions, that's not something that I have immediate plans to do, but it's certainly something that I'm willing to speak about with members of the group.
Thank you so much. I appreciate that. My second question is in regards to training specifically for cadets at the Academy. Can you answer what, if any, bias recognition, racial sensitivity, cultural humility training is received by cadets at the Academy?
We really have focused heavily on communication techniques, and it's because we want to make sure that our cadets are capable of de-escalating situations. Part of the training that they do receive involves racial sensitivity needs, and we have them, the cadets go through basic various classes where they talk about, they have group talks, really. The group gets together and it's sort of facilitated by members of the Academy staff, and they talk to them about needs of different communities, making sure that they're culturally sensitive when they're engaging with people. And we do similar types of training to make sure that cadets that are going to male institutions or cadets that are going to female institutions upon their graduation also have capability to make sure that they're gender sensitive and responsive when they enter their posts.
Thank you. That was very helpful. And thank you again for your presentation and your time being with us today. We appreciate it.
Thank you.
I see that Christopher has raised his hand.
Thank you so much, and thanks again to both of you for the presentation. I'm going to try to limit my questions right now to 2 as well. Thank you, Ben, for that good behavior to have everybody have that chance. My question is about the I appreciated learning about some of the opportunities for inmates in the correction system to develop skills, and you talked about various ways. I'm wondering what does it look like in terms of a strategic plan or for the work of corrections to reduce or eliminate, including programs, for example, like restorative justice. Is that something that's part of the vision for corrections right now, to actually reduce the amount of inmates in our system? And should I go ahead and ask my second question now? Would that make the most sense?
Sure.
Thank you. And my other question would be, I'm concerned about the violation of human rights that I've seen and heard about at facilities, especially the private facilities, and in particular the transgender pod, right at the facility in Milan. And so I'm also want to hear you talk about how do we make efforts to and I think I'm past the point of like, how do we hold them more accountable? But I think it's about how do we move to eliminate those centers in our state is where I'm at, in terms of knowing that there's a number of health and other human rights violations that have happened to inmates in that transgender pod in the past. Thank you.
All right, I'll start off with the last question. It sort of is more present in my mind. I might even ask you to just repeat the first bit of the first question for me. But so we actually do not have an institution in Milan. I think that might be a federal institution that you're making reference to, but we do have policies in place by which we deal with our transgender populations. We are always very, very sensitive to individuals' gender identity. And when people enter into our system, it's one of the main things that we ask them in the first 48 hours of their stay, or we talk to them about it, and they have an opportunity to meet with medical providers, behavioral health providers, and of course they're assigned caseworkers as they go through the reception and diagnostic process. So our policy, and I will give you the policy number as well, because you can find it on our website, and I want to make sure that everybody is aware of that, but it is policy number 15080. And that really lays everything out very specifically. But just a very quick overview of how our system deals with people who come in and are potentially in the process of transition, or their gender identity is a different one than what legally they might be. We have a committee set up that involves our health services administrator, our behavioral health bureau chief, the adult prisons division director, and the individual inmate also. They all get to participate in this committee where they discuss what best practices would be for that individual, and everything that we do is individualized and is based on every individual person's case. Now, the second thing you asked, I hope I'm picking it up. If I'm not, please interrupt and tell me. But you asked about the strategic plan and whether our intention is to reduce population. So did I get that right? Okay. All right. So I want to also invite you to our website to check out our strategic plan. We do have our reports posted on our website, and I recently published it. I think it was in July or August. The months during COVID don't seem to make sense. 1 week is a month and a month is a year. So it was recently, though. It's posted up on our website, and you can see our strategic plan and how we intend to move forward. So my goal really is to put resources, efforts, people behind doing every single thing that we can do to reduce recidivism rate, which ultimately will affect our population and the number of people that are incarcerated. If we're able to help prevent people from returning to custody, then ultimately we will be able to help reduce the prison population overall. Now that already has happened to a very significant degree. We looked at some numbers, and in September of last year, we were at approximately 500 more in our population than what we are right now. In fact, today's population is 6,044, and our capacity is just under 8,000. So we have room to spread out. We're really trying to be conscientious about things like social distancing and doing everything that we can do to make our facilities as safe as possible. But our emphasis on the re-entry division really is the primary focus is to figure out ways that we can increase education opportunities, vocational training opportunities, give people a real way to succeed when they get out of institutions. If you get out and you don't have any job prospects, then the likelihood of you returning to an institution is much, much higher. And one of the other things, and I already mentioned it, so I won't go into too much depth about it, but it's very significant to be able to interact with somebody who's walked in your shoes. And that is one of the reasons that we are focusing so heavily on the peer mentorship process, not only to train people who are incarcerated in institutions now, but to seek people out there in the world, out there in the community who are perhaps off supervision, who did well, who were able to succeed through the process, and they know what that's like, so that when a person's leaving an institution, they are able to work directly with somebody who has been in their shoes, who can walk them literally through things like some of the frustrations of job applications. And we do all those things with our probationers. Our probation and parole officers do those things. We make sure that we provide services like helping people complete resumes and referring people to Department of Workforce Solutions and things of that nature. But there is something different to be said about the experience that people have when they're working with somebody who literally has been in their shoes. And so we're really hoping that these efforts and the fact that we will be putting more resources, both human and financial, into programs inside institutions, and also into making sure that that transition process pre-release is really intensive, and that every individual gets that direct communication with people in the community. We hope that those things will help us reduce our prison populations overall.
Thank you, Secretary. And Shani, I'm gonna put some follow-up questions in the chat. I wanna move back so that other members can ask questions, but Secretary, thank you so much again.
Thank you.
Barbara Lynn, do you want to go next?
We've got you muted, Barbara. And I know Hussein and
Can you
Mark.
hear me now?
Yes, ma'am.
Sorry about that. Thank you, Secretary, for your time. I'd like to ask questions with regard to the cadets prior to them being hired in terms of your talent acquisition strategy. What does that look like for the cadets? When you're looking at potential cadets, is diversity a consideration in your strategy? When you're looking at those that are coming on board, are you just focusing on the technical expertise that's required? Are you looking at more of a holistic view in terms of cultural competence, other pieces, judgment, critical thinking skills, and other pieces in terms of who you're going to bring on board? And do you have a problem in terms of having the cadets that you need? Are there retention problems? What does that look like for your organization?
Thank you for that. You know, I think that in the past, the agency in general really focused on physical fitness #1 above all else. And we really have taken a different strategy. Diversity is a big deal for us, but diversity can mean a lot of different things. And so we are trying to focus on people who, the people that we would typically have come and apply with us. A lot of times will be individuals who are interested in a career in law enforcement, and they don't quite meet the age requirement to join a police force. And so a lot of times those people would come to the corrections department to begin their career. But we are also starting to see different types of applicants now that we've changed our screening processes, really. And we're very grateful for that. We're seeing people now who have life experience coming into our institutions, and people who have have worked in other careers or maybe have retired from other areas and come from all walks of life, really. And that has really been a big difference for us in that we're reaching out wider and in communities, which is not something our agency did in the past. I'll give an example, like, and this is not necessarily applicable at this exact moment in COVID. Right now, we're doing things differently. We're trying to be very creative about the way we do job fairs and recruitment. We do lots of online events now, whereas prior to COVID, we were going out in communities. But one of the things that we've noticed makes a really big difference is that when we go out into the community, instead of just expecting the community to come to us, and we know that we're able to reach out to more people, different types of people, people from all walks of life and all communities within our state. So our recruitment staff members would take their recruitment materials and they would go down to different parts of the state. So they might make a stop out in Las Cruces and then go over to Silver City, and they might cut across and go to Roswell or to Hobbs, and then come on the way back up, stop in Santa Rosa or maybe Albuquerque. But the way that our system previously was working before we made these changes in our academy system is that we would hold screening processes on Tuesdays. That's it. We opened our academy for people to come in and apply and take a test on Tuesday. It was a 2-day test. So if a person was coming from somewhere at a distance like Hobbs, they would be expected to drive up to Santa Fe, spend the night, incur the cost of gas and figure all of those logistics out, pay for a hotel. It was a very expensive procedure, and we really weren't doing a great job of reaching out to the community. And we've definitely changed that strategy now. And like I said, COVID has definitely sparked additional creativity. Our new motto in the corrections world is flexibility and creativity is what we have to do to make sure that we continue to bring people on board and to provide the best possible services. Thank you.
Oh, Hussein, I think you had the next question.
All right, awesome. Thank you, Madam Secretary. I hope you guys can hear me okay. So I'm part of the Health Subcommittee. Thanks for taking the time and talking with us. So I guess I had one comment and hopefully 3 questions if I can fit it in. That'd be awesome. One of the comments was in regards to the gender classification committee, which was part of what you were talking about before. Is there anyone on that committee that is transgender, or do you guys consult? How is that process sort of worked out?
We do not have somebody on that committee who is transgendered, but we do definitely have consultants. And it's, again, COVID is a different world that we're living in right now. And so we're figuring out ways that we can make people available to our populations via video. But prior to the consultants that we worked with, and we had one particular individual who spent lots of time in our institutions, really come in and talk with our inmate populations, provide education to people, and make sure that the individuals that did identify as transgender had access to somebody also who'd walked in their shoes. We really try to spend a lot of time making sure that we create an environment where people can speak to people who had similar experiences in their life. And right now we're just trying to figure out a way to make sure that those consultants are available to our populations via video linkages. But not that this is directly related, but it kind of is. Just in the past month, we've deployed about 150 cameras, the little cameras, over to our institutions. And we've made sure that every single one of our caseworkers and our unit managers have those now in their offices. And the reason that we've done that is so that we can increase the amount of participation that our inmate population can have with community services out in the world. And that's certainly one of those community services.
One of the reasons I ask is, my wife's an attorney and she goes through this frequently. And I have patients who, without saying anything specific, who have had scenarios like this where they are transgender, but they aren't they are sent to a male prison as a result of a committee's sort of decision. And one of their big issues is there's no one who, while they have consultants and people that are talking to them about this, that there wasn't anyone on the committee who was transgender. And they take, just from speaking with my patients, my wife's experience, they've taken some real issue with that. I think justifiably so. So that's one thing I wanted to mention. The other is you guys talked about audits for quality of care, independent audits for quality of care for this provided in the prison. Are these available publicly? Are we able to see these?
You know, I'm gonna turn my my screen over to my colleague here. So I'm gonna put my mask back on and let him talk with you about that audit process.
Okay, perfect. Thank you.
Thank you.
Thank you very much for that question. Just as with every other public record that the state owns, if the request is made, it's screened by our legal department, and if it meets the threshold for sharing, it will be shared. But this is not something that you just click on our website and you find it there.
Okay, so it would have to be like an IPRA request or something along those lines, but you're able to do that if you wanted to, is that correct?
Correct. And I've
Okay.
seen some across my desk.
Okay, perfect. And does that apply for both public, for state prisons as well as private prisons?
Yes.
Okay, because I know there were some newspaper reports 2 years ago, and it had changed, but they were having difficulty IPRAing the private prisons because they were saying that it didn't apply to them. Is that no longer an issue?
Again, as I said, the legal team takes the time to review this, and based on whether they meet the requirements or not, they make the determination of what to share and what not to share.
And I can
Okay,
speak. I can speak in greater detail as well to that question.
Thank you, Madam Secretary.
Thank you. Okay, sorry about that. There we go. Need to figure out a more high-tech situation for this committee presentations.
You guys are doing great.
Okay, so I believe that what that situation was, or rather what that issue was that people were asking to see litigation outcomes that had been settled or handled by private entities, by the private institutions. And so in situations like that, the legal decision is made by the vendor. So whether it's a Geo Group or Core Civic or MTC, they would decide whether to release their legal documentation. And we, of course, would release anything that is public record.
Okay, perfect. So if this group wanted to see sort of these independent audits of quality of care, we would be able to obtain those?
The audits that are performed by our staff, our internal staff of the medical vendor, yes, absolutely.
Okay, perfect, fantastic. And I'm sorry, I appreciate you guys' patience in taking these questions. My other, I suppose my last question, and is pertaining to medication-assisted treatment in prisons, as well as transition for those who were either on it prior to being convicted, it being continued while in prison, and then also helping them when they get out of prison, sort of getting on it, since this is the community standard, I suppose. What is you guys' policy right now on medication-assisted treatment, specifically, say, Suboxone, Suboxone, Subutex, methadone? Do you guys offer medication-assisted treatment in those forms?
At this time, we do not. We did, however, our agency did work with some of the folks over at the governor's office, and we applied through the NGA, the National Governors Association, to participate in a group that was looking at how to safely implement different forms of MAT in institutions. And we do have, it would have been a meeting, but it's a webinar we have a webinar coming up, I believe, in November, where we will be able to talk about that in greater detail and determine whether it is something that could be conducted safely in our system.
Okay, so it sounds like it's sort of in the works. So it's something you guys are working toward doing. That's
It's
what I'm
something
hearing.
that's, yeah, I mean, it's in discussion, and I won't say that we're ready to implement until I know more after we have conversations with that group and what it really looks like in truth and reality.
Fair enough. Thank you. I really appreciate you guys' answer. Thank you.
Thank you.
So, there's lots of different hands going around. Margaret, Anjali, Median, then Azadeh. And I wrote that order down. So that's, so if anyone, okay, I'm done.
Madam Secretary, thank you very much for your presentation. I particularly appreciate the tone of, you're discussing what are issues that are usually fraught. And thank you for, maybe it's the female voice that I'm responding to, but I'm grateful for it. I have two questions. First of all, I'm wondering about the female inmates, and particularly about their obstetric and gynecological care. When they deliver, are they shackled? Are babies, infants taken from the mom? I mean, could you just, and what about the provision of sanitary products for women?
I will start, and then I will turn the screen again to my colleague so we can talk to you all in more detail. As far as the provision of sanitary products, those are items that are provided to our female inmate population by our administration. They're not expected to pay for it. It's something that we provide to everybody who is in our custody. As far as gender responsiveness and working with individuals who are pregnant and things of that nature, we really do lots of work to make sure that people have access to obstetrics, all of the proper prenatal care, all of the appropriate vitamins and the needs that women have while they are incarcerated, not just the women who are expecting, but also just in general, the women that are incarcerated in our system. We make sure that we treat them differently. We work with them differently in the way that we manage behavior. Our policies are very specific in that there are different classification methods. And we recognize right now that our classification system isn't doing what we believe that it really needs to do. And so we're in the process of working with the University of New Mexico to revamp completely, start from scratch with our classification system in order to make sure that it is more gender responsive than what our existing system is. While we do change the point scale for it, we do acknowledge that it's not enough and we need to do more to be gender responsive, and that's something that we're focusing on as we move forward with the university to redo that policy. And then I'm going to turn the camera over here to my colleague so he can talk with you about what happens when an individual is ready to deliver and talk to you about that process.
Thank you very much for that question. So as I already mentioned, one of the things that we really try to do is make sure we are connected with community services so that the level of service we provide to our inmate patients is in par with what is in the community. So we have memorandum of understanding with community clinics starting from prenatal care, where we make sure that the same calendar that a lady outside, an expecting woman outside would be following, we do follow the same. Even within the context of COVID, that remains one of the categories where we never stopped those visits, even in the context of COVID. I do personally receive those requests where they're asking me, there is COVID, do you really want this to happen? And we say, yes, that's an important thing that needs to happen. In terms of what really happens when it's a burden process, they are in the hospital. We never plan for any delivery within our system. It's never planned for any birthing to take place within our system. So it would really be making sure that our assessments are timely so that we transport the female expecting mother to a hospital in a timely manner, and they are provided care based on the hospital standards wherever they go to. I know you asked specifically, are there shackles or things like that? I have not witnessed any, nor have I had any complaint in that respect, because we also have a system where the patient or the inmate patient can complain if care wasn't appropriate, as also members of the community, they can complain if care wasn't appropriate. I have not seen one particularly speaking to that. I know also that recently we've engaged with the Department of Health to address concerns in terms of where this newborn baby goes, in order to make sure that the baby ends in a safe milieu. We have realized that we did not vet our processes identical. As I say, one of the things we're really trying to do is make sure that while someone is incarcerated, we will do our very best to match the same level of service as someone living in the community. And so we've engaged with the Department of Health to ask them, what is the process when someone delivers in the hospital, even when they're not incarcerated? If that mother is incapable, how do you do that baby? And so we've already had one meeting and other meetings planned, and we want to do exactly the same, whereby we will notify the Department of Health that we have an expectant mother. They will interview and conduct the home assessments the same way they would have done if this individual was not in, so that it will support us that when we are releasing this baby, we are certain that the baby is going into a conducive environment.
Thank you. My second question is about the, this is a follow-up question about the training that you do on racial sensitivity, cultural sensitivity. Is it possible for us to look at that curriculum?
All right, I was making sure I was unmuted. Yes, absolutely. Any curriculum the group is interested in seeing, we're happy to share, and we're also happy to take your suggestions and see if there's anything that we can or should be doing better.
Great, great. Thank you very much.
Thank you.
Okay, Anjali, and then Maria, sorry, oh my goodness, Marian, Azadeh, Brian, and Alexandria. Yeah, all in due time. Okay.
Thank you, Madam Secretary, and thank you, Sir Health Services Administrator, for being here with us today. My name is Anjali Taneja. I'm a family physician and the executive director of Casa de Salud, a clinic serving a lot of marginalized folks in Albuquerque, and was also the medical director of the jail narcotics program at Metropolitan Detention Center, a county jail in Albuquerque, where I saw lots of folks going off to prison from their time in jail. And so I was very aware of the issues that existed with people being on Suboxone or methadone in the community, and then in jail being able to continue their methadone, not their Suboxone, and then having to hard detox off of methadone before going to prisons. This was a decade ago when I was the medical director there. We're now a decade later, and I'm concerned about where New Mexico is in terms of provision of standard of care, medication-assisted treatment. To the Health Services Administrator, you noted that there aren't any medical conditions that are not treated in the prison system, but I'm concerned that opioid use disorder is actively not treated, and there are medications that have been used for methadone for over 50 years, over 60 years, Suboxone for over a decade and a half. And many prisons around the country are now incorporating these medicines. Methadone is pennies for the medicine, Suboxone not expensive. We have, as is important, expensive other medications available in prisons. And it would seem incredibly important. I see a lot of patients myself who have come out of prison and vow never to get on methadone again, because if they went back to prison, then they would have to go through a hard detox, which feels like dying for like a month straight. And folks who are on Suboxone, who I've prescribed medication to, but then cannot get that medication in jails or prisons. So I would be curious as to why that is, because it's safely administrable and is done in many prisons and jails, and they're not any more dangerous than other medications that need to be given to patients. And two, in regards to hepatitis C, I'm very happy about what the state is looking to do to provide Hep C treatment. I know in 2018, more than 40% of inmates had Hep C, and only 46 people newly got on Hep C treatment. And in 2019, that jumped up to 126, and there are plans to increase that now. But I would be very curious to hear what the inclusion and exclusion criteria are for folks, if folks are discriminated against for various reasons, including their behavior, other things that should not discourage people from receiving treatment for hepatitis, and what the plans are for, or how many people are on hepatitis treatment now, and what the plans are for the coming year, given thankfully medications are now, with the 340B system, much more accessible to New Mexico. That's huge that New Mexico did that, and the provision of that treatment should be very, very doable. Last part is on the outside with medical behavioral health treatment, housing. It was surprising to hear the news about, despite a 5% reduction in cuts to state agencies for the coming year budget, there's been a 30%, up to 30% cut in provision to halfway houses, behavioral health services, and other things on the reentry end. And Secretary, I know that that's a passion of yours, and so kind of would like to learn a little bit more about why such a huge cut, and how people would not be going right back to prison if we don't allow them or provide for them housing, behavioral health services, and other services upon leaving prison.
All right, so the first issue I will just briefly touch on, since I did speak about it just a bit ago. The medicated assisted treatment situation in our state is not something that our system has done yet. But as I said, we are looking at it to see if it can be administered safely in our system. We do see that it has worked in some other systems, definitely different types of systems, but it's the reason that we wanted to look into it deeper and explore to see what the reality of that was for New Mexico, and whether it was something that would make sense for our state or not. And as I said, that event is coming up in November. So hopefully at that time, I'll be able to speak more as far as what forward movement might look on that subject. Now, with respect to hepatitis, that is, I didn't bring the numbers with me. I do have the numbers, but I do want to also share with the group that was one of our primary focuses last year when we went into the session to look for funding, was how can we fund hepatitis treatment for all so that there wouldn't be exclusion criteria, so we wouldn't have to hold back treatment from any person. And that ultimately is the goal. We want to be able to treat 100% of people in our care. And we worked really hard at working towards that 340B pricing. It had been many years in the making that our agency had been attempting to get that funding provided to us so that we would be able to bring the price down and serve as many people as we possibly could. And we believe that that's right around the corner. We are still looking at funding for that. We're working with the Department of Health to figure out what capacity looks like as far as providers that are able to administer the medication and provide the treatment, and make sure that everybody who's participating in it is educated on the process. But we have the numbers of individuals that have been identified as positive for hepatitis, and we also have the numbers of treatment information. I just don't have it in front of me right now, but that's something that we can follow up with Shani and share. And then on your last issue, which was the transitional housing. So I think there were some misconceptions there. As everybody knows, we are definitely looking at cutting our budget, and our agencies are looking at how we can cut approximately 5% of our budget. The way that the New Mexico Corrections Department works is that we have 4 budget codes, And what we did was we did not go across and just cut 5% everywhere. In fact, the smallest cuts that we made in our budget were within what the budget code is called community offender management. And our cuts in that area were the smallest as possible. So to be clear, when it comes to our work with some of these, the halfway houses or other programs out in the world, what we did was we took what our projected spending was for each vendor, and then we looked at the actual spending from each vendor. And so in some cases, we saw that we had allocated nearly 200,000, for example, to a particular vendor, but by the end of the fiscal year at closeout, they had only spent $100,000 of that. So what we did was we said, well, let's take that extra 100, or that it's not extra, but let's take that 100,000 that this particular vendor did not spend, and let's figure out how we can distribute it amongst other vendors to increase the amount of actual services available to our inmate populations. And so it did appear to be a very significant cut, but to be clear, it was absolutely based on actual spending, and it enabled us to bring more vendors on board to provide these post-release behavioral health services to more of our clients.
Was there any follow-up on that one? Okay. Next was from Marianne, but I believe that she hopped off because I don't see her anywhere in the list. But that question was, is there any state oversight of private prisons and detention centers by for-profit corporation CoreCivic in New Mexico in regards to immigrant detentions?
I believe I understand the question. So if I'm missing the boat, please just jump in and tell me that. But we do have one institution in the New Mexico Corrections Department that is operated by CoreCivic. It is the Northwest New Mexico Detention Facility in Grants, and it houses male inmates. And of course, we have direct oversight over that agency, or I'm sorry, that company in that institution. But do I have direct oversight over CoreCivic as a company in general? No, I do not. I do work with the people that have these contracts with CoreCivic in other areas. I believe they have 2 other institutions in the state of New Mexico. We have worked with them throughout the COVID crisis to make sure that the individuals in their custody are being treated appropriately, separated out, tested, and to make sure that all of the sanitation protocol are being met by the vendors, regardless of whether they're part of our system or not. But I do not have direct oversight over the management of CoreCivic as a company.
I would not know how to ask any follow-ups for that because that is not my area of expertise. Who do I have? Azadeh?
Yeah, I think it was me. And actually, that's a really nice segue to what I was curious about. And again, like everyone has said, thank you so much for your time today. I know we're really appreciative of your time, expertise, and knowledge. In preparing for this meeting, I'm on the Public Safety Committee. I read a few articles about the overwhelming use of private prisons in the state of New Mexico. And I just wanted to hear your thoughts on that. And that, you know, kind of if you had your druthers, how would the state agencies have more oversight or interaction of these private prisons? One of the articles I read said that over 50% of the folks incarcerated in New Mexico are in private prisons.
Yes, many years back, it was the model of the administration who was in place at that time to increase the number of private vendors. And I believe it was back when Governor Johnson was in office when we saw this increase in private prisons coming into the state of New Mexico. And it's really been in place since that time. From my perspective, there are definitely things that we can do to improve the oversight of the way that we work with our private vendors. And some of the things that we're looking at moving forward is to tie outcomes of programming and other things that meet our needs with respect to preparing for release, and tying that to the payment that they receive, so that things would be based on their actual performance and how they are actually having positive impact on the lives of people that are in custody. It's difficult to speak to what is going on in any type of vendors outside of our system. I don't believe that I have enough direct information about counties or federal entities that work with private correctional systems. But in our system as it stands right now, I believe that what happened, or what we did as far as the takeover in the Clayton area, definitely shows you all my perspective about when that's a possibility, that we try to go forward with it when it's realistic and it makes sense for the state of New Mexico. And with respect to the remaining four entities, or institutions rather, that are operated by private vendors, we do have direct oversight over these people. Every single one of them has a state of New Mexico contract monitor housed in their institution, and they go through and make sure that every aspect of the contract is being met. And when it is not, we fine them financially, and we bring them into compliance, or we work towards bringing them into compliance while we are fining them financially for any failures in the contract.
Thank you so much.
So on my list next is Brian. And then I'm going to go with Aaliyah and Ibukun, and then Hussein, because you asked questions early on and I want to make sure that folks get a chance to get their questions in. Alexandria, if we've got time afterwards, we'll pop you back in there.
Thank you. Thank you, Madam Secretary, for your time and the opportunity to ask a question. I was struck by the demographics that were given as far as what the current population looks like, and the majority being people who identify as Hispanic. I'm struck by that because, and what I want to ask about would be pre-release services. Given that a lot of your population is Hispanic, and given that one of our cultural values relies heavily on families, a lot of your people that are incarcerated are headed back to families. And I'm wondering if there are any services offered to families to prepare for the return of these folks that are incarcerated, that would perhaps lay a groundwork that might support recovery, engagement back into society, whether if they need behavioral health services, that they get those. Is there any outreach made to families? And if so, what does that look like before someone is released back into their community and back to their families?
We do some parenting coursework for our inmate population and other things where that we try to work on solidifying those family bonds for our populations before they get out. But you know what, I think that's a fantastic idea and something that we can certainly look into. It's not something that we're doing at this moment where we're providing services in the community to families that will be receiving a loved one, but it is certainly possible for that to become a component of our reentry plans as we move forward.
Thank you for that. You know, one of the reasons why I ask is I actually met with Anthony Romero, who was, I think, the Deputy Director of Adult Prisons at the time, about a program that would do just that. It would train families on how to receive folks primarily with substance use issues. And he was very receptive, but then things just kind of didn't go beyond that. And I'm curious if there would be, it does sound like you're also receptive, but I think that there would be a lot of good done actually engaging the families. It would be voluntary, but giving them some sort of skills to support someone coming out of incarceration to help them reintegrate.
Family support is definitely one of the main determining factors as to whether somebody will be successful outside. I think it's a great idea, and I think that we can exchange contact information and
Sure.
talk in detail offline.
Sure. Thank you.
Thank you.
Aaliyah?
Hi, Madam Secretary. Thank you for being here today. I just wanted to get a little bit more information specifically pertaining to pre-release planning. And so upon an individual's arrival to the prison facility, when does their pre-release planning, I guess, start? Because I know you mentioned that they all have individualized plans. So does it just depend, or how does that work specifically?
That's actually one of the things that we're working on making better right now. So the way that it's working right now is that we identify an individual when they're about 210 days pre-release. And then we start directly working with them at about 180 days, where they start going to different committees, talking about their release plan, telling us where they want to go. And then we start trying to figure out what community they're going to be in so we can connect them to services. But it's not something that we've done great in the past. It's not, and it's something that we're working on improving right now. So what our plan moving forward is the cameras I mentioned, those, I mean, they're silly little cameras, but they're awesome in that they open an entire world that was not open to our populations before. We put them specifically in the caseworkers' offices because we want to make sure that they have direct access to a transition planning expert who will be part of the probation and parole office, that they will be able to meet their own supervising probation and parole officer. And in the institution, that meeting and that needs assessment process will take place with a reentry specialist inside the institution. And they'll be in communication live with the inmate talking about their release planning. And we are looking right now at working with anybody who's ready to release, people who are prepared to release, but the goal will be that we push it back 6 months, and then we push it back 9 months, and then a year, and then 2 years, with the final goal of getting all the way back to when you arrive, that we start your release planning when you arrive. We envision that will take place by using this assessment tool that I mentioned, and I'll just talk a little bit more about what that looks like. It's called a compass assessment. Right now, the probation and parole field officers are using it to help determine what types of treatment or services people who are on supervision in the community might be able to benefit from. But we are going to start implementing the compass assessment with people who are preparing to release right now, with the ultimate goal of getting to the point where we initiate a compass assessment when somebody arrives, so that while they're inside, their treatment and services and program participation can be in line with what their individual transition plan says. So even if somebody's entering into our system and they have a 10-year sentence, they will spend that period of time working towards meeting their own goals of their own transition plan. That's our big vision moving forward. And for right now, we're starting with everybody who's close to release and pushing it out as far back as we can. And so far, it's already starting to make a change in people's perspective on the inside, because they are having direct access to the field, and that's not something they ever had before they got out. So that meeting, you're releasing from prison and you go to the probation and parole office, you're nervous and you're doing an intake and you don't know who anybody is and you've never seen anyone and you don't know what to expect. We're trying to end that by making sure that those introductions are made before people get out. So right now 210, but the goal will be to push it out as far back to entry. Thank you.
Awesome. Thank you so much.
Eva Kun.
Yes, I have a question. Thank you for your time so far. My question is actually going back quite a bit in the process to one of the questions asked earlier about actually reducing the number of people in the facility. And I think that a great way to do that is to have a probation department that actually functions better, an improved probation department. And that way a lot of people who would have just stayed out of the prisons from that end don't end up in the prisons. My concern is that in the outlying areas, a lot of the outlying areas in New Mexico, including Region 4, which is where I am, we actually lack resources that will assist probationers to be successful on probation. A practical example will be a client that came through our office recently, actually a number of them, who complained that who would prefer, instead of going to a rehab, a treatment facility somewhere far away from their family, they would rather just go to prison and do time and come out of there, as opposed to seeking treatment that's near impossible to get, seeking resources that's near impossible to get in this area. This is a thing that adversely affects minorities and people who do not have the resources to pay for their own treatment and their own rehab facilities. So my question in light of all of those concerns is that what is being done, if anything, to improve resources that people have on probation and parole in outlying parts of New Mexico, in the smaller towns, in the places that are not central, that are not the bigger cities? What is being done to have resources in those areas so people can go down the street and get what they need to succeed while on probation?
Well, without a doubt, and I'm sure that it's not new information for anybody in this group right here, but our state definitely lacks resources. They do. We lack provider resources in every way in most of our communities throughout our state. Whether it's medical providers or behavioral health providers, it's something that our state has been working hard to try to fix. And so I'm a member of the Behavioral Health Collaborative. And with that group, there's a number of secretaries, cabinet secretaries on that group who have direct interaction with behavioral health services throughout the state of New Mexico. And they are doing a ton of work. In that group, we're doing a ton of work to try to incentivize some of the programs that keep New Mexicans in New Mexico providing services to people within our borders. So things like incentivizing education curricula where people go through a social work program, for example, and then receive some sort of financial incentive for having taken that coursework. And we're trying to do that type of thing to create or improve, increase the provider network that's available in the state of New Mexico. As far as my agency in and of itself, we work hard to, via region, by all of our regions, reach out to existing providers in communities and try to engage them in contracts with us so that we can provide services to as many people as possible. And that's definitely not always a reality. There are definitely some communities in our state where people have to drive a distance to get from one place to another. And as everybody knows, of course, there's not a whole lot of public transportation. And so we do things like provide transportation vouchers to try to get the person to go from here to there without having to incur any kind of financial cost. But in general, it's something that our state is working hard to improve. And I do feel very strongly that the Behavioral Health Collaborative will help our state move that needle and make some legitimate progress in availability of provider resources throughout the state.
So the next set of questions that I had on my list was from Alexandria Taylor. And I wanted to note that in my conversations with Secretary Tafoya Lucero, if we do want, so she asked, what is a percentage breakdown of people of color in correctional facilities compared to actual percentage of the New Mexico population? And is that data available by race? I believe that you can definitely pull that data. And as far as comparing it to New Mexico population, we can find some way to do that part too. So I've noted that, and we'll make sure that we get that out to the group. And Alexandria, did you want to ask your second question?
Sure, thank you. Hello, Madam Secretary, thanks for being here. And thank you to the chairs of the subcommittee, Azadeh and Hussein, for allowing me to join you today. So we conducted a study of women who were currently incarcerated in New Mexico that found 67% of those in the study had been victims of sexual assault over their lifetime, 89% had been victims of physical assault, and 62% had been victims of stalking and harassment. And so my first question is, in what ways has the department strengthened their commitment to being more trauma-informed? And then when I worked in Valencia County, I actually provided advocacy within Central, and I saw the medical unit where women were taken to when they were incarcerated in need of medical care. And I just am wondering, what is the status of the state's compliance with the Prison Rape Elimination Act? Thank you.
Sure. We're certainly committed to working with our populations, the women in our custody. We do know that many of them have experienced trauma in their lives. We have a wide behavioral health network within our facilities. We have behavioral health providers at every location, and we make sure that we focus on that, particularly in our women's institutions. It was tough for us for a while there to recruit behavioral health providers, and we were fortunate to get support from the Legislative Finance Committee to bring those folks' salaries in line with competitive areas. And with that, we've been able to decrease our vacancy rates amongst behavioral health providers. And we also do contract with some corporations through our medical vendor to increase the availability of behavioral health services inside of our institutions. And I mentioned just briefly that in our curriculum at the Training Academy, we do teach our officers and our staff members things like behavioral health, first aid, trauma-informed care, and it's something that we are very much committed to. Now, on the second item, PREA, that's actually one of the areas that we are exceptionally strong in. In fact, I believe it was last year, our state received an award that only had been received by 2 states by the American Correctional Association. It's called the Lucy Hayes Award. And that award was given to our state because every single one of our institutions was fully compliant, both with the American Correctional Association audit requirements, as well as all of the regulations that are part of the Prison Rape Elimination Act. In every single one of our institutions, we have a person who's fully dedicated to PREA. We have investigation procedures in place in the event that any type of a PREA complaint is made. We do very, very detailed tracking of any types of complaints that are made and very thorough investigations of any allegations of any type of harassment or inappropriate behavior in that area. So we are a very strong state in that area. We have trained auditors on our staff. They will do what they call mock audits with our institutions. And then they also will conduct PREA audits throughout the country. And we are part of a multi-state consortium that collaboratively trains each other's staff and then has staff conduct audits throughout the country so that people can become experienced with other systems and improve their auditing skills to make sure that we're always in compliance with that very important law. Thank you.
So I want to speak to, there was a comment asking for any of the curriculum that you guys do on de-escalation, racial sensitivity, bias recognition, cultural humility. I'll work with Secretary Tafoya Lucero to pull that information for both subcommittees and Kaylee. So we can get that out to you guys. Hussein, we had some follow-up questions on some stuff, something about November, and I'll leave it to you.
I apologize. I'm sorry. Yes, sorry, just jumping in. Thanks again. I was writing and I didn't catch what you said, the name of the committee, the meeting that was in November in regards to medication assisted treatment in prisons.
It's through the National Governors Association. And
okay.
Yes, the state of New Mexico will be participating in an event to discuss the viability of bringing medication-assisted treatment into our state.
Okay, fantastic. Thank you. And then the other question was, earlier when we were talking about the sort of the, I suppose, transitional housing funds that were sort of decreased to the actual number that was spent from the previous years. You said that that was done so other vendors or other resources or reentry resources would be available. Would you be able to either send us or tell us about what some of those other reentry resources are?
So what I was saying was that when we had allocated a large or a particular specific amount of money to one vendor, and then that vendor did not spend the money, that we were just trying to make sure that the money was utilized if it was available, that it would be that it would still be available for us to bring additional vendors on board. I can certainly have our folks put together a list of all of the vendors and companies that we work with, that we have contracts with throughout the state. We do keep that information and we're in regular contact with them. So yeah, sure. And I also believe that it's available in our annual report, which is also on our website. So maybe I can put the website in the chat if I can figure out how to do that, so everybody has the link to it. But if not, I'll send it over to Shawnee and then she can send it to the group. But I'd be happy to provide the list to you. Yes.
Okay, that'd be perfect. Thank you. And I appreciate it.
Chris, we're coming back around. Christopher, I'm sorry. It's late. It's past 5.
I have no worries. Thank you. Thank you for correcting yourself. You got it. Thank you. I wanted just to revisit my, I'm hoping, because I know you've talked about it several times, and my apologies. I guess I want to make sure in terms of, and maybe this is something after today, about the oversight of I'm particularly concerned about the transgender pod at the facility. And I apologize. I thought it was in Milan, but I guess it's outside of Grants and not technically in Milan. But I'm concerned about the human rights and health violations in that facility. And I've been told by legislators that we have the ability in the state to hold them accountable. And I heard you both say that, but we've had at least one person die and a number of other people have serious allegations against the facility around withholding medical treatment. And it feels like one of the best things to do would be to close that down, because there's not accountability for that. And my second question that I wanted to follow up with was around the recidivism. I understand that a high number of inmates in our system are there under a drug conviction. And I'm wondering two parts to this. If we have information generally, because I know I don't want to violate anyone's privacy, generally about drug convictions and inmates, especially around disaggregated for race and gender, but also what are the programs that we are looking at to divert people into corrections and into drug treatment and recovery programs rather than putting them into corrections. And I understand there might not be time to answer those questions, but maybe Secretary, you could get that information to Shawnee or to Amy and we to share with the committees.
Actually, I could speak to both of those concerns. So the first one you mentioned, I think you're referring to one of the federal ICE institutions with respect to those pods and areas. It might possibly be the one in Otero. I'm not 100% sure. So again, to clarify, the New Mexico Corrections Department does not have direct oversight over federal institutions in the state. We have been working with our federal, the people in the ICE area and in the U.S. Marshals to make sure that they are in compliance with the COVID regulations. And there are, of course, other mechanisms by which to report an institution or a vendor within the state to have them looked into further. So perhaps like OSHA complaints and things of that nature. This is something that I can follow up with some of my colleagues on and see if there's something that our state can do to interfere with that private vendor and the folks that operate that ICE institution that I believe that you're referring to. The second issue was I'm sorry.
It's okay. You've done such a great job. It's drug convictions and
thank you.
diverting people with a drug conviction to treatment rather than the correction system. Thank you, Secretary.
Thank you, thank you. Well, so if a person's on probation, then, we're legally required to report any kind of preliminary violations to the judiciary, and the judiciary makes the decisions on whether a person on probation is sent to an institution. And of course, the parole board makes the decision on whether a violation leads to a revocation. Our agency, of course, we process, we house, we work to treat every person who's in our custody and in our care. But also as a member of the New Mexico Sentencing Commission, it's something that we're talking about regularly, is looking at increasing diversion programs out in different areas within the judiciary. It's something that we strongly support. And we do right now work very closely with drug court and areas that are available throughout the different court systems. And we're happy to involve our staff, bring our probation and parole officers and put them on committees, and anything that we can do to increase pre-adjudication, detention, and anything that we can do to contribute to diversion programs. We've seen those are very successful all over the country, and we would be happy to see if we could be a contributor to increase any of those diversion programs.
And Secretary, I just have a follow-up question again that you don't have to answer now, but I'm hearing my Professor Montoya's voice in my head about, I think it's really important that we address how racialized our drug conviction, right? I appreciate you talking about the parole system in particular, about how many people are in corrections because of a parole violation potentially with drugs. And so I'm wondering, is there data available from corrections about disaggregating based on race and gender? What does it look like in terms of incarceration rates based on drug convictions? Like, do we have access to that kind of information at a state level?
So our system does keep records of people who are incarcerated with us. Of course, it's based on the self-report at intake, and we're actually one of the few agencies that does collect race and ethnicity data. That's another conversation that we're having right now in the Sentencing Commission to see what we can do to bring any other law enforcement entities on board with collecting that data on the front end, so that all of us can have cohesive information available. Our computer system is not the best, though. I mean, I'll be real with you. It's been it was started up in 1999, and it's on what they call Power Builder. It's a legacy system, so it's this really old school database, and it may or may not be capable of pulling data at that finite level. But I would venture to say that while we can pull things like who's incarcerated in our system, I can't be confident in saying that we can pull that and the offenses that people are incarcerated for now. We are in the process of working towards deployment of a new computer system. We're real excited about what that will provide to us as far as our ability to pull data at a more granular level. But I do know that we can provide you, and we will provide you through Shawnee, a racial breakdown of our institutions.
Thank you so much.
We're getting short on time. Who do I have? Ben Como.
Thank you. And this was just a follow up to a question that I had asked earlier, and also that Azadeh asked. I am wondering if you can speak a little bit more to the rationale for continued utilization of private facilities. I know you mentioned that this was a carryover from several administrations back, from the Johnson administration, I believe. But for continuing using those, I'm wondering, are we tied into multi-year contracts, or is it a cost-saving rationale? And do we have the capacity and the manpower to begin to look at taking back oversight of, or not oversight, but actual administration of those facilities?
So I suppose I'll start by talking about Clayton. So when we looked at the Clayton facility, we knew going into that it certainly would cost us more money to operate that institution than what we were paying by contract. Every one of our vendors, of course, is under contract, but on both sides, on the side of the state of New Mexico, corrections department and on the side of the vendor, there are always termination clauses that allow either party to exit the contract at any point with a specific amount of notice. And that is present in every single one of our private contracts. But as we moved to take over the Clayton facility, the first thing that we're looking at is the building itself and the lease and the cost of the lease and how that process works, and bringing in all of the other entities that have to be part of that conversation to make sure that it is something that's realistic and sustainable. And then our agency has to do lots of work to make sure that that transition can happen. And then we go through the hiring process of seeing how many of those individuals we can hire so that we don't leave a community without employment. It's a very multi-layered process. And again, like I said, I think I made my perspective clear in taking over of that institution, but it certainly is a complex undertaking. And in the case of the Clayton institution, it definitely did cost us more money. And that has to do with a lot of different factors, pay and benefits for employees and things of that nature. I won't say that that will fully deter us from moving forward in the future, though.
Thank you.
Thank you.
So, and Anjali, I know you put a few more questions in the chat. I don't think we're going to have time to go through these. It is quite a bit of information, and I don't know that we'll get time in our last 2 minutes. But what
they were just follow-up questions for reports and other things that we might be able to acquire. Yeah, not for now. Yeah.
Okay, we will definitely read into that. Margaret, did you have one? Oh, you're muted.
Just a last general question, Madam Secretary. We're an advisory council on racial justice, and I'm just wondering if you have any legislation that you're following that you're concerned about that advances racial justice that you want to bring to our attention.
Thank you for that. We are looking at lots of different aspects of legislation moving forward and talking with different state senators and representatives to determine where our overall priorities will be. That's definitely one of our priorities. But we're also very, very eager to hear recommendations from this group so that we can determine what the issues are out in the community and then figure out how we can support that by moving forward with legislation. So we're really looking forward to seeing recommendations from here so that we can determine what our moves will be around these issues as we move into the session in January.
Thank you.
Wow, you guys are good at this. We went right up to the end. Thank you so much, Secretary Tafoya Lucero, for being here and answering and giving us great information and stuff that I think these subcommittees can really take back and marinate on. Before we all depart, for Ozaday's subcommittee, for the Public Safety and Law Enforcement subcommittee, we are considering trying to get in an hour next Thursday at noon so that we can come back from this conversation and talk about suggestions and moving forward, since we did not get that time today. She did send out an email on it. So if that works for folks, email me, we'll figure that out and get something together for next week so we're not running out of time. Kaylee, Amy, am I missing anything?
Hussein?
Awesome. I was just going to throw something out there that the same for us. I think we still have, we haven't really started narrowing, and we can do it via email or we could meet again. I know we all have very busy schedules. I'll email you guys, or I'll talk with Kaylee, we'll email and kind of see what works for everybody, but just kind of expect to see that email. Thank you.
Margaret?
Yeah, Joe.
I just wanted to know what the status of the two issues, the racial justice impact assessment and the early childhood education with the use of the land grant permanent fund, because I'd like to make some recommendations about how it gets sent to the main committee.
The racial justice impact will be seen at the main council next Wednesday, and the early child education will be in the education subcommittee, but we don't have a date yet.
So can I circulate something to the health subcommittee about the racial justice impact assessment? So I think that there are some specific recommendations about how to both long-term and short-term, some specific recommendations about how to make it more so that we increase the accountability of it.
Sure, you can send anything to Kaylee and she can send it out with the weekly email of information.
Great, thank you.
Anything else outstanding?
Before we depart, I just really want to say thank you to everybody on this group today. It's been great to have this dialogue, and I look forward to hearing from you as we all move forward. So thank you for having me today.
Thank you, Secretary.
Thank you, Secretary.
Thank you.
All right, everyone, good evening. I think this is our wrap up. I don't have control over the meeting, but I'm leaving.
Good night.
Bye.